Again, this is Alex McDevitt with the Reproductive Health Supplies Coalition. I just want to welcome everybody to this webinar. We're really excited to have everyone joining us this morning and this afternoon. Just a few logistics points before I turn it over to Nancy Muller. Every attendee is automatically muted. And throughout the presentation, you'll have the opportunity to write in your questions into the questions box that's on the control panel. We'll have a question and answer portion after both presentations have concluded, so feel free to write in throughout the presentation if you have a burning question, and just note that we'll get to that at the end. So Nancy, I'll turn it over to you to go ahead and get started.
Great, thanks Alex. Hello everyone, this is Nancy Muller. I'm a Senior Program Officer at PATH in Seattle, and also a co-chair of the Reproductive Health Supplies Coalition Menstrual Health Workstream. We're delighted to have this very first webinar on a topic I think that's so important and has been very understudied, which is about what the market access and the needs of girls and women are related to menstrual health products. And the focus is on India and Ethiopia. We are going to have a presentation first by Maria Carmen Punzi from PSI Europe. She's the program coordinator and menstrual hygiene and health expert in the PSI Europe office. And Patrick Aylward, who's also been involved with this study, is a senior market dynamics advisor at PSI. He is available to answer questions. And then Shamira Nakalema, who is also a co-chair with me at the RHSC Menstrual Health Workstream, will present about the youth perspective after Maria Carmen has finished the presentation. So I'm going to mute myself and welcome, and we'll have questions at the end of both presentations. Thanks so much. Go ahead, Maria Carmen.
Thank you, Nancy, for the introduction, and it's very exciting for us to be here today and to talk you through some of our learnings from the market analysis of India and Ethiopia that PSI has conducted in 2017. This work was funded by the Bill and Melinda Gates Foundation, and we hope today to be able to share what we found out. So let's see whether I can. Yeah, there we go. So as many of you are probably familiar to, in 2016, there was a report published which was titled An Opportunity to Address Menstrual Health and Gender Equity. And I think that's really where we're standing right now. So how can we tackle something so essential to women's health and well-being? And while qualitative research suggests largely that girls experience shame and discomfort during menstruation because they lack access to the products that they prefer, that they can feel safe with, as well as private and safe facilities and education, we do need further evidence to establish the clear linkages between poor menstrual health and other health development and outcomes. So that's what we were trying to do with the study. And still in the report, menstrual health interventions are explained to feature a number of critical components. So today we're focusing particularly on access to products, and we acknowledge that that's just one part of the broad spectrum of points that we need to address when we talk about menstrual health. But this study in particular was focused on understanding access and barriers to menstrual products, both from a purchasing standpoint and also from supply. So again, this study, the project scope was really about understanding what are the motivations and the barriers for adolescent girls and young women to use either homemade or commercial products. Who are the girls that are not accessing these products, and what are their preferences? Because that's something that we noted. It's very hard to understand, and it's often not included in our programming. And also from a supply point of view, what are the constraints and how can we help unlock potential opportunities to increase access to these preferred products? So just to make it short, but we have, of course, more detail on this in our reports, we use 5 primary sources of information when we looked into the Indian and Ethiopian menstrual products market. PSI conducted, and especially the marketing team, conducted an extensive literature review of available information about these markets, qualitative research featuring focus groups as well as in-depth interviews, quantitative research in the form of a discrete choice experiment to understand features that are preferred by girls, stakeholder interviews with suppliers and manufacturers, as well as solution workshops through our local teams and other NGOs, as well as representatives of ministries. So this table is just here to give you an idea of what these markets look like. So what does the Ethiopian menstrual health products market look like compared to China and the United States? We see, of course, a huge difference in terms of market value. But if you look at the number of women aged between 15 and 54, both in India and Ethiopia, it is a pretty high number. So this just can tell us that there's a huge need for this kind of menstrual products. And I think it's also interesting to look at the units per woman, considering that, on average yearly in China, for example, a woman would use 290 menstrual product units. So let's talk a little bit about consumer preferences and access limitations. So we asked girls, first of all, we found out that girls would want to use commercial products, but we really wanted to understand why. And I think I want to make a disclaimer here, because when we talk about commercial products, we usually think disposable sanitary pads. And in this case, I mean, this is what we're talking about. But I think what's interesting about what we found out is really that we wanted to understand what drives this preference. And I'm going to explain briefly why. So the girls and the young women really made it clear that they are afraid of stains. So leaking is a big concern for the girls. And the fact that the commercial pad can be a stick to the underwear and it often has wings gives them a sort of security that the leaking won't happen. And this is the same for the increased mobility. So it's really ingrained in the girls. They want to be free to move, go to work and exercise, even on their period. And they just notice that the homemade cloth won't do the work. So it will make them feel uncomfortable and especially insecure. So again, girls prefer commercial products. And I know that there is an ongoing discussion, reusable versus disposable. But I think what's interesting here is that we understood that the problem for the girls is not necessarily this discussion, but rather what would, allow me to have a normal life when I'm on my period. So it's not really about I want to dispose of the product or I want to reuse the product, but I want to feel free when I use it. I don't want to leak. So as this next slide shows, affordability is a major barrier, but this is an issue because the girls actually do want to use the commercial products when they can. And what we did find out, and I don't have a slide for this, but it's very interesting that a lot of girls resort to mixed use product. So when they stay home, they use cloth, but when they go out, if they can, they really are going to use commercial products. So this is to tackle affordability, of course, if they cannot afford to use commercial products all the time. And this just speaks to the fact that they want to, again, feel free and sure of not leaking. So affordability is a major barrier. Of course, when we talk about access, this is something that we need to tackle. And this can be considered from two different angles. So one is household prioritization, and that's to say that while the girls can buy the products themselves, they often ask money to the mother. And the answer is often, well, if you've used cloth so far, why would you spend this essential money on something like pads when we could buy flour or grains? And again, the price sensitivity is pretty high. So at least, as you can see from the graph, at least in Uttar Pradesh, the willingness to pay was less than the market price, which of course is an issue in terms of access. And this slide might seem counterintuitive compared to what I just said, but actually it's not, because while price matters, quality delivers value. And what we did find is that many free and subsidized programs don't deliver quality. So I think it was in Ethiopia that we found that some of the girls that received free pads through a program preferred giving the pads away to their mother, or even reselling them in the market and try to get some money to buy the branded product. So this shows that just delivering free pads of lower quality won't do the job. And when we analyzed the data from the discrete choice experiment, what turned out to be the case was that the key preferences that drive the purchase or the choice of the product is stickiness, the length of the pad, the wings, the absorbency, and then the cost. So that, of course, plays a role, but it's not necessarily the main issue at stake. So we don't have so much time to go through all the major barriers in here, but what we did find, additionally to the price sensitivity, is that disposal is still a big issue, especially in rural areas. Girls both in India and Ethiopia really have a challenging, hard time disposing of their pads. As well as access to information. So as it's probably not a surprise to any of you that the girls did not receive any information about menstruation before their menarche, before their first cycle. And many of them really said that they wanted to know more. So I think that's, you know, we're going to talk about it later more, but there is an opportunity to speak to them in that sense. Furthermore, access to clean water and private space is still a big challenge as well. And this especially when we talk about school and the workplace. And fourthly, the male harassment at the site of purchase was also something we found out. So we found that the girls and the women, even if they do have the ability to buy the product and to go to the shop, whether if there are males around, they're going to feel very embarrassed because when they go and buy the menstrual products, they will receive sexual comments, because especially in the areas where where menstruation is connected and linked to sexual activity. So we talked briefly about the access, and from the consumer's point of view, let's talk a little bit about the supply side. So India, as probably many of you know, is the fastest growing market in the world. And in terms of menstrual product, it's going to go bigger and bigger. However, it's far short from market saturation. So despite its rapid growth, the commercial menstrual products have not penetrated the market yet. And it's, you know, they're still relatively low used when compared to other developed markets. And it's estimated that the saturation point will be reached after 2060 with 110 billion pads per year. So this scheme is supposed to show you roughly how the manufacturers' landscape looks like in India. So you will see that roughly 80% of the multinational company, 80% of the market is dominated by the multinational companies, Procter & Gamble and Johnson & Johnson first and foremost, and then Unicharm and Kimberly-Clark. And then the other 20% roughly is for domestic manufacturers, largely of disposable pads, and there's a very small percentage working with biodegradable or reusable pads. So it was quite a hard task to get information about these large local manufacturers, and it's not really clear what the scale of production is, but they have addressed some of the rural markets gaps. In Ethiopia, it is a bit different. So the situation looks like, the market looks like it's split between domestic manufacturers and Chinese imports. So the top two brands, one is imported from China and one is manufactured in Ethiopia, but it's a Chinese brand. And in both cases, we have quality challenges. The market does not really reach or cover the rural areas due to macroeconomic conditions like limited access to foreign currency. There's high stockout rates, which means that even if the girls do get to the shops, they might not find the products. And there is at this point currently a low brand loyalty, which is not the case in India, because we know that the girls, if they can, they will really want to access the branded products. So when we talk about use, in the end, in India, 40% of the adolescent girls and young women only exclusively use homemade products. So this means not just reusable pads, but cloth. And the vast majority of these girls are living in rural areas and are in the lowest income quintiles. So the data consistently showed that as income increases, then use of commercial products will also increase. And this is also true for age. So as the girl grows older, she will tend to use more and more commercial products. So what we did find for sure is that it's a challenge to create a profitable business models to serve the rural populations at scale. And while a lot of attention has gone into creating new products and new production model, we haven't really looked at how to find ways to incentivize large-scale producers to reach the rural areas. And as we know, rural areas have significantly bigger challenges and higher costs for manufacturers. For example, importing of the raw materials, the high transport costs due to the transportation and due to the lack of infrastructures. The promotional costs are higher, so the awareness of the products that are available is lower. And finally, the government response has often been fragmented and ruled by other kind of agendas like employment generation rather than increasing access to products. However, we do have a few points about what are the opportunities moving forward that we can consider to make this market, a better one, hopefully a more inclusive one. I put 4 here. We have many more in our reports, so this is far from being comprehensive, but it was really for the sake of time, and I hope this is still useful. So first of all, giving girls access to the products they want. I recognize this is very challenging because if the girls are not aware of all the products that are out there, how can they choose? But that's why I think they should really be included in the design of the interventions that target them. And access to these quality products should be prioritized over other competing agendas. And understanding also what do the girls need and realistically what is their background and what can they use better. And of course, help them with responsible disposal, because we did find consistently that disposal brings anxiety to the girls and they don't really know what to do with the disposable product. And considering the projections of the markets that we just talked about, we will it's a problem that we will have to face. And while we of course don't have to overestimate it, we also don't have to underestimate it. So this is why I think the second really opportunity is to leverage partnerships with those actors that can achieve scale in manufacturing, distribution, and marketing. And this can be done in a number of ways. So for example, incentivizing production in those areas with large unmet need. We already said before that, especially in rural areas, it's very hard to access these products. And this could be done through taxation, for example, favorable for these manufacturers. Aggregating rural school-based education and awareness programs, and this would serve the purpose of making the girls aware of the products that are out there and that they can get access to in their area. Incentivizing the use of locally sourced absorbents, because we actually did find that what drives the cost up very often is that the absorbents are imported from places like the United States and Sweden, where the labor cost is really high. Involving manufacturers in the design and scale up of disposal solutions, because as we said before, this is increasingly is going to be a challenge that we have to face. And also utilizing product packaging and inserts to feature educational materials. So for example, we know that in India, Procter & Gamble is already reaching millions of girls every year with these products. Can we use these products and can we use these audiences to convey, positive messaging, correct health information about menstrual cycle and reproductive health more at length? Thirdly, can we explore application of subsidies through targeted demand-side intervention? So while we did talk about the problem of affordability, there is indeed a problem of awareness and demand creation as well, especially in those areas where there is less space and room for marketing and for advertisement. So we could, for example, try, and this in the family planning space, it happens quite a bit, the using of vouchers and coupons at the category level to understand what kind of choice the girls go for when they can choose where do they want to purchase the products. And also this would be a way to incentivize quality and provide retailers with an incentive to stock products, because we said before this is a challenge. And finally, this promotion could be integrated with adolescents programs in school, working on existing sexual and reproductive health and rights campaigns. Which brings me to my last and maybe most important point, which is really about the opportunity to integrate menstrual health in sexual and reproductive health. I want to say that, you know, at a PSI level right now, we are partnering with the Case for Her, and we are exploring the linkages between menstrual health and sexual and reproductive health, because we acknowledge that while products are an essential part of menstrual health, they are only the starting point. We really found in the data that the girls want to know more about menstruation. They want to know more about how to prevent pregnancy, how to prevent STIs, how to prevent catching HIV, and they want to receive this information. So menstruation is really the first critical step of the reproductive health journey. And the links with family planning, you know, with the research that is coming up right now, they're clearer and clearer. So when, for example, there's bleeding changes due to hormonal contraceptives, the girls fear that they're becoming infertile, and then that's how discontinuation happens. And also, even in more conservative settings where sexual conversations are really taboo, menstrual health can be a good entry point. So this is really a call to action for all the sexual and reproductive health practitioners on listening, but also for everyone else. Like, products are a magnificent way, I think, to entry this adolescence world with a lot of, you know, power and marketing. But can we do more? And can we as practitioners really take this this opportunity? And I think this is where my presentation ends. Let's see, this is the acknowledgements with all the people that contributed to this study. And I want to bring it back to Nancy. I'm happy to hear your questions later, but I know Shamira will call in right now. So thank you for your attention, and I hope you enjoyed.
Thank you so much, Maria Carmen. That was great. So much information in a short time, and on such an important topic that doesn't get enough attention. And there's a lot of richness in what you have found in your research in these two countries that I think will help the whole field to move forward in identifying solutions. In the interest of time, I think we will move straight to having Shamira provide her presentation. And I should say that the menstrual health workstream is falling under the leadership of the new and underused reproductive health technologies in RHSC, in conjunction with and interest by the Youth Caucus also. So this is a joint, kind of a cross RHSC initiative, and Shamira is very active in both, but also is representing here the youth perspective. So go ahead, Shamira.
Thank you so much, Nancy. And thank you so much, everyone, for attending this webinar. As Nancy said, Nakalema Shamira. I work with Women Uganda as the training coordinator. And I'm also a co-chair on the
Hey, Shamira, I think we lost you for a sec. You muted yourself. Could you unmute?
Hello?
Yep, okay, we can hear you.
Okay. Thank you, Nancy. My name is Shamira Nakalema. I work with Women Uganda as the training coordinator, and I'm also the co-chair on the RHSC MHM workstream. We'll present to you the different young people's perspectives on the access to the menstrual health product research that was conducted in both Ethiopia and India. Next slide, please. So we had reasons as to why we asked different young people to provide their views on this report. And one of the main reasons were MHM impacts young people, and they have specific barriers to accessing products, but also young people for young people. Young people should be involved in shaping the agenda and the direction of the MHM research. That way they'll better understand what their own barriers are and issues. So they should also be involved in building the discussion on how these research results can be utilized across different contexts. Next slide, please. Next slide. So who did I contact? I contacted different young people under the RHSC Youth Caucus and around the world, and they shared their views from what they thought was great to increase young people's involvement in different programs, research and solutions to the identified barrier to the MHM research that was conducted in both Ethiopia and India. So I sent out different questions based on the report to different young actors, and a number of youth actors responded differently to this report. So I reached out to other different representatives, but unfortunately, different young people didn't have time to give their views. So I would love to thank the different young people that were in position to give their views on this research. So I would love to thank Hassan from Pakistan, and he's the founder and the RHSC Youth Caucus chair. I would also love to thank Halima Lila from Tanzania. She's the AD of Hope Center for Children and Women in Tanzania. I would also love to thank Mandy Tembo from Zimbabwe. She's a PhD candidate at London School of Hygiene and Tropical Medicine, but also Chloe from Uganda. She's from Ethiopia, but she works with a youth-led organization in Uganda. She's the Grant Acquisition and Project Officer. So next slide, please. We asked different questions to different young people, and one of the main questions were, what do you think, how do you feel the research like this on menstruation is relevant to young people? What do you think organizations like PSI should do to improve youth-friendly services? Next slide, please. Different young people broadly raised different interesting views on the report from this different contextual perspective, and they came up with different ideas on how to address the different barriers. They also agreed on the 5 core opportunities that came up from the report, and one of the agreed views was having a holistic approach to include menstrual health management in the existing sexual reproductive health right programming. Young people also agreed that though the report found that in Ethiopia and India there is a need to focus on rural market, reusable products and locally available materials, we also need to know from global research that there is a better access to products in urban areas. The youth representatives also emphasized that we should not forget the specific barriers that girls in urban areas and young women in urban areas have to product access. The young girls and women in urban areas have different experience. For example, lack of private space in congested urban environments that makes drying of the reusable products and private waste disposal difficult. There is also some evidence on transitional sex that is linked to menstrual health products and from that urban environment. So there is need to consider that and understand it better. Also, different young people agreed that product choice was very, very important, and different young people should be given products they need and on when they would want to access them. They also say that access through the entire menstrual health journey is very, very important, but young people raise the need to better understand how the changes across the menstrual life cycle happen and what factors impact it along the way. Because they gave an example of learning to be menstruators. What a 10-year-old experiences would be totally different from what a 20-year-old who has learned to menstruate experiences, and their menstrual needs would be totally different. Next slide, please. So MHM is an integral part of sexual reproductive health, and it is essential that adequate MHM be aligned with the basic human rights, thus allowing it to be an important part of discussion in private and public sector, for example, homes, at work, and at school. So menstrual health has to be addressed using comprehensive and holistic approach that is both informed and supported by evidence-based research, linking practice to research and research findings to policy change that positively impacts the consumer's journey. WASH is also seen as critical and should be addressed in a context-specific manner, as menstrual health practices are influenced by different limitations and inconvenience of adequate WASH infrastructures like access to water, lack of access to private toilets, among others. So still in the holistic approach, young people raised the view of the importance of creating sustainable structure. They said that there is a need to be consistent on these support structures, for example, menstrual health knowledge, pain management, and other factors, to not only consider the product, but also other supplies that comes with it. For example, if someone is to use a reusable pad or a disposable pad that is given to her, she needs a nika. So we need to consider those supplies. We also need to consider the painkillers that manage the pain management, the hot water bottles that manage the pain management, among others. But also, young people raised a view of involving different community-based health workers, because these health workers know the communities, the community well, so they will deliver the MHM information and they will provide youth-friendly services. Next slide, please. As we saw in Maria's presentation, there was a challenge of male embarrassing the girls that purchased the products. Different young people raised a view of involving different male stakeholders. So they agreed that in the report, it looks at girls' willingness to pay for the products, but the feedback that I got was that it is always from different contexts, and we need to know who is willing to pay for these products and who pays for these products. I would give an example of Uganda. A mother or a daughter asks, or she's the one who goes to buy the product from the shop, but then she has to ask the husband or the father money to go and buy. So we need to involve those male parents so that they understand the need for these products. So different young people came up with different suggestions on this, and one of them was drama and edutainment to increase awareness, address different cultural norms to the community members, and make different stakeholders take responsibilities, but also involving and empowering the shopkeepers and the male parents, because if we are to buy the products from the shopkeepers who are male, they also need to have the information and be empowered so that they don't embarrass the girls that buy the products. Next slide, please. Another key view or theme that came from different young people was product accessibility and availability. In the report from both Ethiopia and India, found that the girls use both disposable and cloth, but if they had enough disposables to manage their menstruation, then they would only prefer to use only those disposables, because then it provided comfort, it could stick and what have you. But it is important that we just don't think that if girls had a single product, then they would only just use that. For example, here in Uganda, Umena conducted a project in northern Uganda in a certain refugee settlement, and girls were given menstrual cups and reusable pads. So girls would use reusable pads during dry season and when they had access to water. But then they would use the menstrual cup during the rainy season because then they would not dry their pads. So different young people also agreed on the need, or agreed on the challenge of waste disposal and referred to a solution of making biodegradable materials or biodegradable menstrual management method. They also agreed on the import, export, and tax exemption, like Mandy Tembo from Zimbabwe. She said that MHM products should be considered an essential good in policies, allowing for tax-free menstrual products and low overall costs for local production and sale. This could encourage local production that is environmental friendly and culturally appropriate, increase access to menstrual health products, and increase product choice. Another thing that came out from different young people was they wanted to know how different people defined menstrual health supply, because most of the time when we talk of product accessibility, we only think of products. For example, menstrual cups, tampons, reusable pads, and the disposable pads. But how about other supplies like painkillers, soap, knickers? Shouldn't these be considered? Next slide, please. So we also identified a number of different areas where research could be more youth inclusive, and different young people said that there is a need for more research like this to address context-based barriers. They also said that the report does not differentiate the age groups. There is more need to have age-aggregated data to address different young people's needs, but also develop age-appropriate messages to increase youth-friendly services. They also said that there is need to broaden research to include different young people with different challenges. For example, young people with special needs, young people at workplace, and out-of-school girls. Not forgetting the specific challenges to the pre-urban and the urban areas, but also the quality of the products used in real life, because sometimes we find that we get different products, but we don't have proper instructions on how to use those products. Also, young people noted that there should be choice linked to family planning. For example, if I use Depo-Vera, then after usage I get spotting, I need to have a product choice that I should use. Should it be a menstrual cup? Should it be a disposable pad or a tampon? And is it of quality? Yes, I think my presentation will end there. Thank you so much.
Thank you, Shamira. That was fantastic. I feel like the two presentations together really got into a lot of the deeper issues and also offered some potential areas that we might look at as beginnings of solutions that could address these challenges of menstrual health as an essential human right. So I think we have a number of questions. We should move into those, and people can add their questions in the questions box. But I'd like to raise a few that have come up already. One was following up on Maria Carmen's presentation and asking what was the size of the samples for the qualitative research in India and Ethiopia, and also was it focused only on the rural areas? That was the first question, Maria Carmen. The second was what percentage of those interviewed had not heard of commercial products, if any? So I think that issue of how did you get feedback on products that maybe girls had not yet heard of, girls or women. So I'll mute Maria Carmen, and you could address those questions.
Yeah, and I might just want to pass the ball to Patrick, who is also online. Patrick, if you may.
Sure, I'll have to look up the sample sizes. We did a few different phases of research in both Ethiopia and India. So the first phase was really focused on interviews and focus groups. The second phase, then we did quantitative choice experiments. And for the quantitative choice experiments, we had a sample size of essentially 1,200 individuals in each country. The sample sizes for that, we focused on, in India, we focused on urban and rural Uttar Pradesh. And in Ethiopia, we focused on Addis and Sandafa. And then what our team found was that we were surprised in Sandafa, which is a peri-urban setting. We were surprised by the very high use of commercial products there. And so the team then expanded out to more rural areas and did another sample of 300 adolescent girls and young women. The focus groups and one-on-one interviews, I will try to pull that up as we speak because I'm not quite sure on those sample sizes. But with the individuals, I believe it was in the neighborhood of 60 to 75 individuals, but I can pull that up. In terms of the product awareness, we found in all settings a very high awareness of commercial sanitary pads. We did not find similarly high awareness of alternative products such as reusables or menstrual cups or other types of products.
Okay, thanks, Patrick. So does that mean that they were aware of the commercial disposable products, but not aware of alternative products? So in terms of, it sounded like you collected some data on willingness to pay or ability to pay. How was that affected by awareness of products?
Yeah, good question. So for the willingness to pay pieces, essentially what we did was with the discrete choice experiments, we had a number of different variables and trade-offs that were set at differing levels. With that research, I would say it was the baseline products were the disposable sanitary pads, and then we asked, based on that, what other attributes or how those attributes influence the willingness to pay and vice versa. So I would say that in terms of that willingness to pay data that we showed, I think it is fairly specific to products that adolescent girls and young women are familiar with.
Okay, thanks for clarifying that. There's some cheers for the youth perspective and appreciation that was brought in so strongly. So thanks again, Shamira, for that. Another question was, for how long was the research carried out and what areas were considered? Was there an age limit? So a little bit more information about the ages, I think, including the choice of up to 54. I think there was a question about menopause being, I think, technically often listed at 50. And then also what was the youngest age, and how did you aggregate those different ages in your research?
Yeah, I think, sorry, I was just seeing where the 54 came from, but that was just an indicator of the population of the country. So we actually only looked at adolescent girls and young women, so that's 15 to 24, not up to 54. I mean, I guess that there's a lot of different ways to put or like choose the target groups. We were also looking at national data from India, and I'm sure Patrick can speak better to that, but we were trying to have somewhat of a consistent target group so that we could aggregate also PMA 2020 data and also Indian, what was the acronym for it? NFHS, maybe, national data. So of course, I mean, we acknowledge that menstruation starts earlier these days, but it was more, I think, a matter of practicalities. And Patrick, if you want to add something, please go ahead.
Yeah, I would, and I can circle back on that, the sample size question. For the qualitative research in each country, we did about 40 in-depth interviews and about 20 focus groups. Regarding the age groups, it was focused on 15 to 24. At the request of the foundation, we were really trying to understand the perspective of adolescent girls and young women. And so that was the focus. And as Maria Carmen mentioned, we then tried to compare our findings with household survey data from NFHS4, which does have some questions on menstrual hygiene, and I think there are some challenges to that question, but it does provide some basic data. Unfortunately, as far as we can tell, that the data that we have from the NFHS4 is only for the 15 to 24 age group.
Thanks, Patrick, for clarifying that, and Maria Carmen. There was another question about the whole kind of category of information that was shared with the product manufacturers and whether the results have been shared with product manufacturers and the social enterprises, and if so, what they think, what their responses are, and in particular, a question about was this issue or the suggestion, I think that Shamira raised perhaps from the youth perspective of having educational materials, and maybe you said that too, Maria Carmen, included in product packaging. That seems like an interesting approach. And where do manufacturers sit in terms of this potentially massive market that you lay out for not only disposable products, but also, of course, these other product categories that women and girls are saying that they would be interested in, to the extent that they know about them and can afford them. So how are manufacturers and suppliers and social enterprises looking at the data that you came up with, and what are their responses, if any?
Yeah, I'll maybe speak to that. So we did hold workshops in both India and in Ethiopia, where we tried to engage the local manufacturers and suppliers as much as we could. And then we also held some additional one-on-ones. I think that what we found is that the supply base is fairly diverse. And we found varying levels of interest in the findings. So some of the manufacturers, I think, were keenly interested in the consumer research, as well as some of the challenges that we found in rural areas. And I think that some of these findings kind of emerged from interviews that we conducted with them. I think in terms of then the engagement at the country level, I think there's still a lot more we can do there in terms of continuing to bring them into the discussions and bring them into, moving policies forward.
That's encouraging to know. Is there, and also in terms of sharing this with the donor, do you have any response that you can share about where the interest is in taking this work forward, or in the donor community? Have you had much of a response to all this data that you've collected and some directions that you've pointed for ways forward?
Maria Carmen, maybe you can jump in on that one. I would say, I think one of the challenges that we've found at PSI and also within similar organizations and including some of the donors is where to position menstrual hygiene in the strategy and the portfolio. And I think that what we found is that has been a challenge for many organizations, donors included. But I do think there is movement there to shift some of the focus. And Maria Carmen, perhaps I think you've been a little bit more involved in that space than I have.
Yeah, I'm happy to jump in on this. I think, as Patrick was saying, we've been talking about menstrual products for a long time, and with a lot of different organizations, a lot of different donors, and I think that the reasons why there's still some uncertainty is that there's so many different preferences, there's so many different contexts, as Shamira was explaining as well. So it's quite challenging to address the market, which is something that I think typically PSI or organizations like PSI would do. And that's why we were really speaking to the reproductive health part, and I think at least for us internally as an organization, that's where we placed menstrual health, and that's where we see it strategically, acknowledging that the wash part and the products part is absolutely essential, but also understanding where can menstrual health be a competitive advantage. And I think also to understand that we're not just talking about teenagers, we're not just talking about 15 to 24. At the end of the day, we're all talking about the life cycle approach. So we, as PSI, we see very young girls, but we also see mothers and even perimenopausal women. So I think that's also where menstrual health has a whole different importance. Like, how can we use it as a predictor of good health? Where does it intersect with our needs and or the girls and the women's needs for family planning products? So I think also from the donor side, there's not a necessarily unity, or there's not a agreement on where the funding should go. And I think the products landscape has honestly been challenging for them to tackle. But I am very hopeful, and I see even through our country offices that at the end of the day, we need the menstrual health information, but also education to lay out and to bring forward our programming related to sexual and reproductive health.
Thanks, Maria Carmen and Patrick. That's a helpful framing and context. And I think that it's exciting that this is being presented in the Reproductive Health Supplies Coalition. I think it acknowledges the leadership role RHSC is taking in that very topic of landing menstrual health in reproductive, sexual and reproductive health and rights, and in that context. And there was a question actually that referred to that, saying, given the potential for linking up with the family planning platform and the reproductive health, could you comment on the possibility of bundling menstrual health products with family planning methods, especially where bleeding changes could be expected? So that's sort of a different angle of this.
Yeah, and I think that's a very interesting comment, and we for sure would welcome that. I know at least internally at PSI, there's been a movement towards helping our health workers in the field to address the concerns regarding the bleeding related to contraceptions, to different contraceptives. So that could definitely be something that moving forward organizations could look at. I know that, for example, when it comes to MA, to a medical abortion, there is sometimes provision of pads as well, but I cannot speak any further on that because I'm not sure about, I don't have many more information, but I'm sure that could be something that could, be explored. And I think more and more, especially because we found out that, not in this research, but I know that research shows that at moments of, at important reproductive health moments in the journey of a woman, there's also the need or the desire to change products. So, for example, after the first pregnancy or after marriage. So for sure, those two things should be linked up. And I cannot talk more than that, but I definitely endorse the idea.
Yeah, I might just add one thing. I think so we did qualitative research in both in Uttar Pradesh, where there are major gaps in access, and in Tamil Nadu, where access is much higher. And one of the interesting findings I thought that emerged from Tamil Nadu was that a lot of women had gained access to commercial products at maternity clinics. And then that had really driven their adoption, but also adoption by their daughters. And so I do think, thinking about this using the life cycle approach is worthwhile. And I think there are probably many more types of points where these needs intersect.
Absolutely. And that's another comment that was raised by one of the listeners that she wanted to mention, is the whole life cycle approach. And that is, everyone I think acknowledges that menstrual health and menstruation, menarche, is a perfect opportunity to reach young women and before menarche with information about their bodies, their reproductive physiology, and give them more of a sense of control and knowledge of how their bodies are working. However, it extends across the entire, reproductive age span of a woman. So, and I think that the focus has very much been on the youth in menstrual health, and assuming that women have figured it out somehow. I think that, as you say, there are so many changes through the whole life cycle that needs to be acknowledged as well. And I feel like this work is really, highlighting some of the possibilities. And, I certainly heard the challenges of the rural areas, and that seems like a ripe and important area for people to be looking at. And it seems like in those contexts, some of the more sustainable, locally produced products, but also the issue of quality having to be addressed at those rural contexts. Because was there some feedback from ministries that you received? I feel like that's one of the areas that is coming up too. In the questions, were the ministries of health or other ministries, women's affairs in these countries, what were their thoughts about these issues, and were they interested to commit to kind of a range of products for girls and the quality issue?
I think one of our findings was that it's really been a mixed bag, and I think in India, we found, when we looked at even different states, we found at the state level very different, large differences in terms of the engagement of different government agencies. And we also found that the response was very disaggregated, and lots of different organizations working in the space, but all at very different levels. And we found some with very different competing agendas, as Maria Carmen mentioned, in terms of driving access versus driving local employment. And I think that that is something that a lot of government officials struggle with a bit. And as a result, I think that has some implications on the quality of products that are delivered. I think one other point that I would make is, in terms of, on the supply side, in terms of the production of the large scale kind of production models, in both India and in Ethiopia, the products are, a lot of the raw materials for the products are imported from other countries, and that adds significantly to the cost. So one of our recommendations was, if there are ways to incentivize the local sourcing of some of the product components, then that could potentially lower costs and address some of these kind of dual incentive schemes in terms of increasing access, but also having an impact on the local economy.
Patrick, thank you so much. And we are a little bit past time. This has been such a great experience to have all this rich information and the questions that have been coming in. Thank you all for attending. And also, please note and remember that the RHSC General Management Meeting is being held in Kathmandu, March 25th through 28th. And please go on the RHSC website and register if you plan to come. There will be a lot more of menstrual health on the agenda, along with all the other rich topics. in RHSC. So thank you again for presenting, Shamira and Maria Carmen and Patrick, and we look forward to further webinars on this topic. Bye-bye.
Thank you, everyone. Goodbye.